All right, we're live on Facebook.
Hi. Welcome, everyone. We're a little bit early, so we're just trying to share some of the live stream around to different pages of people that we know are interested in these issues. So if you just give us a minute or two, we're trying to start right on time at 6:30, and I have 6:29 at the moment. So just give us a minute here. We are just so happy on this 1st of September to get some information out to everybody. There's just been so many questions and so many pieces of information flying around, and we want to try and get some answers to what is happening. And we hope it'll serve everybody, because accurate information is the best way to go. So we're just going to wait for Kara to come back on. But I would just like to acknowledge that we have a couple of organizations, very much grassroots organizations, involved in this effort to put this together tonight. And so 2 of the recognized organizations were on the flyer that went around. One is the Facebook group called Hawaii for a Safe Return to Schools, which was founded back in June of last year. And actually our founder is Burke Burnett. He's on there. He is a parent. And when I saw parents joining together, I, as a teacher, joined in with them. And so I also am involved with Hawaii for Safe Return to Schools. And so parents and teachers both networking on that Facebook page, trying to share information, trying to help each other out, and working toward that common goal of trying to keep the schools open safely. That's what we're all hoping for. Then we also have Kara Flores. She is here from Hale, Hawaii. She's the founder of that grassroots organization. So I would just like to start out with Kara. We are using their page because it is a public page, whereas the Hawaii for Safe Return to Schools page is a private page. You have to join it. But the Hale, Hawaii page is public. So we are using that to share out. And if you do want to ask any questions to our speakers, please type them in the comments on the Hale, Hawaii page, because that is where we're going to be receiving questions through our networks. So I'm going to ask Kara to speak, introduce herself a bit, and then Kara, if you could also introduce your husband.
Yeah. So I'm Kara Flores. I'm the founder of Hale, Hawaii. We are a community advocacy group that started because of the COVID-19 pandemic. So we push for safer measures when we don't see something working, or we try to help the community in any way we can with resources and connecting people, things like that. So we connected with Safer Return to Schools along with several other organizations, and have done a lot to help with school safety recommendations and bringing on people who have information to share with the community. My husband is Frank Flores, and I'll let him say hi, but he is an electronic engineer. We're actually both electronic engineers. We met in engineering school, and he is certified. He's EPA certified on heating, ventilation, air conditioning. So if you want to say hi, Frank.
Frank, if you want to unmute yourself and just tell us a few words about what you have a special interest in as far as this health and safety issues go.
Yeah, just wanted to say hi and thanks for having me on. You know, with everything going on, you can't help but be involved and have many opinions and questions. And so hopefully with my background and maintenance and engineering and everything I've been involved with the government, that I can help provide some input.
Thank you. And Burke, would you like to say a few words before we introduce our guests, or have them introduce themselves?
No, I don't have any special nuggets of wisdom, so why don't we just get into it?
All right. I would like to ask Gary Bignami, who is working for the DOE, and I don't know your official title, so if you wouldn't mind sharing what your title is and what you kind of oversee in the DOE. Gary, I think you're muted.
Yep. So I'm Gary Bignami. I'm a program specialist in the environmental services unit. And with respect to COVID, I've been involved with ventilation issues. And we can get into some of the details of that later, perhaps. The environmental services unit covers a lot of different areas: asbestos, lead, drinking water, indoor air quality, soil contamination, a bunch of things. So this is, an addition to that. I have a background in toxicology. I have a master's in toxicology and 30 years as a scientist in the biotech industry.
Wonderful. And Mr. Tanaka, Randy Tanaka, I'm sorry, he wants me to call him Randy. Randy Tanaka, would you mind introducing yourself? I believe you joined DOE in your position in the beginning of 2020, is that correct? Oops, you're muted. I think you're muted. There you go.
Yeah, got it. So aloha, everyone. Hope you're having a great evening. Yes, I joined the DOE in January of 2020. Previous to that, I was with the Department of Economic Development. Previous to that, with the University of Hawaii Community Colleges. And you're beginning to think now, can this guy hold down a job? Prior to that, I was involved with the world's largest environmental conservation congress called the International Union of Conservation of Nature. And through the East-West Center and DLNR, we organized that conference. We spent 8 years trying to get it to Hawaii, first time in the US. And prior to that, I was with the Hawaii Convention Center. I opened the convention center way back when. So my background is logistics and facilities. And prior to that, I was on the island of Kauai and did some tourism things in the hotel business. So yes, I can't hold down a job, but it's every place I've been has been a lot of fun.
Well, thank
Randy,
you.
I think you picked the worst possible time to jump into this job, January 2020. Lordy.
When I was moving from DBED to DOE, and I have a fair amount of friends in government, and they go, "Why do you want to do that?" I said, "Well, let's see what we can do." It's been a tremendous challenge, but at that, I can see why teachers do what they do. My wife was a teacher; she's retired, and it's like farmers and teachers have a different kind of passion for this, for what they do, and until you're actually close to it, you understand why. And so it's a good thing. It's probably the most challenging job I've had because the organization is huge.
Right.
So it's I think moving the Titanic would be easier, but we're trying to make a difference here. So we go from there.
Well, we really appreciate any transparency. That has been what everyone's searching for. So we just appreciate your presence here today. So I'm going to start with a couple of questions that we've had coming in. And so the first one is, how are schools being supported in their reopening plans and health and safety strategies? Who reviews the individual schools' plans? And what is your department doing to ensure adequate staffing in order to monitor that implementation?
You got to look at the DOE from a holistic standpoint in terms of there's an academic side to ensure that we're meeting the national standards and the uniqueness of our place on the globe. That we're, in tourism, we used to say the most isolated set of islands in the world with a phenomenal culture that has had history of educating each other and trying to understand, when you go back to what the Hawaiians did in terms of the a'apua'a and the caring of the place, it's very unique. I will also tell you that the organization, We're one of the oldest educational systems in the nation. We have schools, I think Lahaina Luna is like 140 some odd years old. I was just outside of Hilo to Kalaneanaole Elementary School, which is 100 years old. So there's a lot of knowledge. There's a lot of systems in place. And in this dynamic place that we are now, it's constantly changing. It's not a function of, there's never enough money. There is never enough money, but it's a list of priorities and trying to address how we continue to pass on knowledge to the next generations and how do we get them ready going forward. And it's not an easy task. It's tough. The principals and the teachers now are full of so many other stuff to concern themselves. Separation, make sure, we do, the DOE does more than just educate, right? From the morning when we pick up your kids, we care for your kids, we feed your kids, we educate your kids, we try to teach them manners, and we're trying to impart, habits that make them good citizens. And it's a Herculean task, but some of the teachers, all the teachers do a great job. Right?
Well, that's so awesome to hear as a teacher myself, but we're really just talking about because of the, so many of the schools had their own plans last year, so they published their own individual plans. And so we're just wondering, was there any review of those plans at the state level? And, if there were plans that schools put out, was there any support to make sure they had the staff to actually implement the plans they created?
So all the schools have plans, right? They're required to build plans and budgets. And that is reviewed by what is called a complex area superintendent. So they review those plans and provide input with, the plan has to be deliverable. It can't be a pie in the sky plan, right? And then you look at student population, what happens out on the Nanakuli Waianae complex area is not the same that will happen in the East Honolulu or, the Kamuela on the Big Island, Waimea. It's customized to the area that the school is. So yes, there are plans and they're reviewed by the complex area superintendent, and the deputy reviews those plans and discusses it with the complex area superintendent.
Okay, cool. And then the staffing piece was the last part of that question, because I know, for example, my school where I teach, I was speaking to the head custodian recently, and she was saying that they have been struggling to fulfill all the requirements and they're doing the best that they can, but it's been a struggle. And now, we have been hearing in the news and elsewhere that there's been some people pulled in from district, from the office to do some subbing because of the shortage of subs in some areas. So we were just wondering if, since you guys are in charge of the health and safety piece, are you able to offer full-time positions, part-time positions, temporary employment to people in order to fulfill some of these challenges?
Yes, so for a little while, there was a freeze when the budget, when the state's budget was in distress, right? Because of COVID and the shutdowns. And that's the economic reality, right? So we made adjustments in all areas. And slowly we could request for positions and we, especially in our food service area, there was no request that was denied. And I know because it all comes through me, right? So we authorize every labor support. The challenge we have is, like every other business in the state of Hawaii right now, is getting labor, right? And that's, the workforce has diminished for whatever reason. I hear people moving out of state, finding other jobs, and that's, I think, a natural course of any community. People come and go and leave, and you all know it's quite expensive to live in the state of Hawaii.
Right.
So how do you maintain that? We see a lot of multi-generational families in some of our communities. We know that because of the counts in our schools when we look at what we anticipate student population, and it's more than what we anticipate. That is contributed by GEs, exceptions to go to that school, or more families, multi-generational families living in a household. So we try to balance that with our workforce, but we have not. So the short answer is we have a labor pool concern, but we have not stopped hiring. I mean, we would love to hire more cafeteria workers, but they're just not out there.
So in other words, if they go to the DOE Office of Talent Management, they will see some postings for positions, because this is going out to a lot of people. So
Yeah,
maybe
those-
there are people out there that would like to apply. Is that what you're trying to say?
Apply through the website.
Okay, great.
Mhm.
Let's move on. And I did want to interject because I forgot to mention that Burke does have another engagement. He will be having to leave the call at some time. But, so when he leaves, he's not insulting anyone. He would just have to bow out quickly. So just know that.
Family
So
obligations.
I'm going to move. I'm
Good
going to
man, good
move
man.
on. Yeah, he's a family man. But I'm going to move on to the challenges in the schools about isolating those who have symptoms on campus. We've heard a lot of feedback on this. So just tell us about the challenges you've heard of and how those are being addressed.
So couple things, the dynamics of this. First, we follow the lead of our health authorities, which is the Department of Health, and they take into consideration the things that CDC is saying, and that has been quite dynamic. Back in March, when we first got wind of this, everything was 6 feet, mask up, and those considerations that CDC said. So Department of Health digests that, gives us direction at that point. So it's changed quite a bit. At a certain point, they said, well, 6 feet, maybe not, 3 feet, or what is possible, right? And we all know it's difficult, especially the K-6 group, to kind of keep them separated. So, we follow the multi-layering process. You got to mask up, right? The challenge we have in some situations is not everyone is symptomatic, right? A kid comes to school, 2 days later is not feeling so good. They come to school, we isolate, we call the parents, and then they go get tested. Now, this is not only for kids, but it's for staff and it's for teachers. So we follow those same protocols. The best thing.
Oh, I think what we were talking about, not so much the social distancing, but like in the case where, here I am a teacher and a kid comes in sniffling. And so I send the kid to some schools, the health office, some it's the principal's office. And then once they receive them in that location, have you heard of any challenges of them like not knowing how to supervise them when we know they could potentially be having the virus? So like, would the employee have to be in the same room with them, for example, to supervise them while they're waiting for their parents to pick them up?
No, so we send them to the health office. The nurse does a preliminary review and we isolate the child. We call the parent that they need to come and pick up the child. And the child stays in isolation until the parent comes and picks them up.
So isolation sounds like not supervised. Gary, do you have any insight into this? Have you received any reports where school staff have a challenge because they don't want to be in the same room with a potentially infected person? Gary?
Actually, no, that's not normally, my level of participation. So I really can't comment with the experience on that. The nurses' offices are equipped with HEPA filters, and I would suspect that the children are not completely isolated and left, to to wonder what's next on their own, but I don't have direct visibility on that.
Well, speaking of the HEPA filters, this is a great interest, I believe, to Burke, and he has his hand up. But I'm just going to ask the question first, and then Burke, I'm going to ask you to chime in. We just wanted to know if anyone is evaluating the ventilation characteristics of each of these classrooms, each of these indoor spaces. And whoever is doing those inspections, what are their qualifications?
So we have contractors that manage our air systems, especially the closed systems. So when we went and built the metric for evaluating all our schools, what Gary gives us is some guidance on this is what it should look like. So we have 12,000 classrooms in the state. The first thing we looked at is all the systems that did not have louvers, immediate access to outside air, because everything CDC and Department of Health was saying is you need circulation in the room, or you need to keep them outside. And some are easier to manage than others. So we evaluated and we came up with 39 schools, I believe, that had limited access to outside air, meaning there wasn't a louver or a window that we could open. So in Gary's identification of things, and I'll let him further elaborate on it, we went out and got 4,000 air purifiers and looked at especially those rooms that were most vulnerable because we couldn't get outside air into it. So Gary, you want to talk a little bit about those filters, or those air purifiers?
Sure. So we brought in actually over 4,000 air purifiers. These are Austin Air Healthmates. They have a clean air delivery rate of about 300 cubic feet per minute, maybe slightly less, but in that ballpark. The advantage of these systems is that they have a very high capacity filter that isn't expected to need changing for at least a year, probably more. So compared to some other competing devices that need filter changes every 3 to 6 months, that was looked at as an advantage. Plus, they're sort of built like a tank, and they basically have an on and off switch, so they're simple. So a number of factors, and DOE had some experience with them actually on the Big Island due to VOG. So we went with those. There's a whole lot of different air cleaners out there. I strongly advocate for HEPA filtration as opposed to some of the more exotic technologies, ionization, photocatalytic oxidation, etc., hydroxyl generators, ozone generators, things that I think actually degrade, or at least have the potential to degrade the indoor air quality, especially for sensitive individuals like asthmatics. So as Randy said, we've got 12,000 classrooms. We were able to distribute 4,000 HEPA air cleaners. Be nice to have even more. We have also distributed 12,000 box fans and created a website on instruction on how to use those box fans, as well as over 600 carbon dioxide sensors, and how to use those to assess whether ventilation is sufficient. A lot of moving parts, and the principals are overwhelmed with all the responsibilities they have, and this is just one amongst 100.
Yeah.
So implementation at the school level is not uniform, but we are providing resources. I'm available for guidance, and We are, as Randy mentioned, the 40 odd schools that have central air systems that we're evaluating. We are actually in the process of issuing a contract to deploy carbon dioxide sensors to those spaces and do continuous monitoring of the spaces to be able to see what the conditions are in real time.
Thank you. We've got 2 hands up from our parents. Burke, I'm going to take you first because I know you've got to go, and then we'll
Yeah,
ask
thanks.
Frank to chime in.
Yeah, thanks. I can't think of a more important issue facing schools with regards to COVID than ventilation, because we know that, the only kids who can get vaccination are kids over 12 and older. And even all those 12 and older haven't gotten vaccinated. I heard one estimate that only about 25% total of our students have been vaccinated. And we also know the next mitigation strategy is masks. We know with Delta, cloth masks don't work. Surgical masks aren't very effective. Really, the only thing that will work against Delta is an N95 grade mask. So those 2 things being operative, really ventilation is absolutely key. And there's 2 ways to do that: either air exchange, replacement of air in a space, and we understand that's not possible, especially in a short term, given some of the budget issues and things like that. So it becomes an issue of filtration. But this is absolutely key.
We actually have distributed 12,000 box fans that will facilitate natural air exchange if people will use them. So that's not altogether true. And I would say that it's a gradient that a surgical mask or a cloth mask is better than nothing. An N95 is better still. And even more than ventilation, that masking is probably the most important mitigation step. The receptor and the emitter being filtered 50% right at the start.
Yes, excuse me, but I work in science, so I'm quite familiar with all this. But the problem is that masks are not worn correctly half the time. As any teacher can tell you, students wear below their nose. They have a gap between their nose and their face. Let's not pretend that masking is carried out in the most optimal manner. So and a box fan, while great, will simply recirculate potentially infected air. For a box fan to work, it has to be pointing outdoors or drawing in fresh air from outdoors or blowing out contaminated air. So
the direction is to use them as an exhaust fan in rooms that have louvers.
Right, but my understanding is, because I asked this question specifically, why can't a teacher put the box fan at the door pointing out so it will suck in air from the top and blow air out? I was told that it goes against fire code. The teachers who tried to do this were told by the principal, stop doing that. It's against the fire code.
So Burke, all that both you and Gary say are all correct. Right now, this is the first time I've heard about the fire code issue, but what is most important to us is that we know what school that is and what classroom it is, and has nothing, I've heard the arguments of retaliation, all of that, but I can't fix it if I don't know who, what, and where, because I will run to the principal and say, you got to get over there and here's the standard. Gary, when we first came out with this, we had this document that we expect everybody to read, and and I know not everybody reads it. So then we came out with a training video, and that's online. So the next step really is, and the hardest part of this is knocking on the door. What are you doing? Here's the measurement. And we rely on the principal or the vice principal to facilitate that. That's why those monitors went out. Now, it's an imperfect solution, but it's what we got right now. And if everyone executes as best we can collectively, we're going to get there. But I hear what you're saying. We realize, and what Gary says is, I went to a cafeteria and they're blowing the thing inside. I said, brother, this is what you got to do. You got to turn the fan around. He goes, oh, I didn't know. And I wanted to tell him, if you read the stuff, you'll know, but that's not a solution. I mean, we're not here to to beat up on anybody. We're here to facilitate the correct action.
Yes.
And
If I can just jump in one thing, you know, I still get these questions from teachers saying, why can't I put up plexiglass things? Why won't that protect me? And it drives me crazy because one, that won't protect you against an aerosolized virus. And two, it actually might hinder air circulation in a classroom. So the degree of misinformation, well-meaning misinformation that's out there, but that is hindering an adequate response it's discouraging.
yeah,
Yeah.
oh yeah,
And,
Burke,
and,
you're
and
absolutely
Mr.
right.
And
Mhm.
Randy, we definitely want to get that website and those training videos out to the public because I know a lot of teachers that have never been told about any website or instructional videos. So I'm going to pass it over to Frank real quick and then Kara, because they've had their hands up for a while. Frank?
Yes, I just had a quick question to you, Gary, when you were talking about the those air purifiers and HEPA filters. Are those falling under the maintenance contract of the central air systems in the classrooms? Because I asked because we use high efficiency filters for all kinds of things at my place of work, and being on Maui, those things clog super quick. I mean, we're replacing them more than once a year. I mean, some of our units we're replacing 5-6 times a year, and some, depending on the location, a lot more, just because of the air quality on Maui. So my question to you is someone monitoring these, or do they get routine checks to see if they do need to be changed, or how are they being taken into account?
Short answer is no, but there's a 5-year prorated warranty on the filter. So it's expected that these, unless if you put a HEPA filter in a really dusty room, these are not panel filters, they're a conical shaped, and they're unusually high capacity compared to a lot of the HEPA systems out there. They're going to eventually need replacement, and that's I don't know, Randy, have we resolved whose responsibility that is?
It's all at the school level, right? It's the custodians because they're also responsible for the air systems, the systems that are there. I can tell you with absolute certainty that not all of them are cleaned on a regular basis, but we're working to get that done. Right?
Getting
There's
back
no
to
way.
the staffing, yeah.
Well, it's part of their routine, but so I'll give you an example of the complication that and I mentioned Kalanian Only School outside of Hilo. So it's an old school, doesn't have the electrical infrastructure. I get calls that the devices are tripping, but what we got in there now is we got the Austin filters, we've got Chromebook chargers, and we've got daisy chained power strips all over the place. So I go up there and I said, boys and girls, not a good thing. Fire hazard, right? So you got to manage it differently. And so that's the difficult part of when we look at 257 schools, some of them do it better than others. We continue to work to try to get them to do the right thing. And that's a task that we rely on 257 principals to help us execute.
And I know Kara wants to speak, but I just wanted to follow up on the air filters and box fans, because you threw out some numbers there. And like you said, 12,000 box fans, you also said 12,000 classrooms. So that's one per classroom approximately. I guess there are some classrooms that are on the air conditioning systems. But we also are curious with those ratings of those air filtration or air cleaner systems, is the cubic footage of the classroom be taken into consideration to create how many numbers of those are in the room? Because I know of the band room at my school, it's got a hugely highly ceiling, and it's connected to the same air conditioning system as the room next door, which is my acting classroom. And I asked my principal if we had the MERV 13 filters in there, and he said, I have no idea. All I know is that band room got a filter, one, and that's a huge room. So that's not enough. And I think that, we've got enough parents on the call right now and watching on Facebook that, we can put political pressure to spend some of those federal funds on the things that we need for our children. And so, we want to build support for your department to do what needs to be done with staffing and with these units that will help. But in order for us to put the pressure, that's why we're here to talk about these issues and ask if we can support the department here. And Kara, your turn.
So I had several questions, and I think I probably know the answer because I'm guessing it's the custodian. But who uses these CO2 monitors? Who sets up the fans and makes sure they're set up correctly and monitors their use? And if it is the custodians, I mean, are they technicians? Are they the world's highest paid custodians? Or what's their training? And then I'm worried because a lot of kids right now are eating lunch in their classroom, including our son's school had all the kids eat lunch in their classroom. So to keep them in cohorts, right? But I'm concerned because there's no mask when you're eating lunch. And if you're in a small classroom that doesn't have enough air changeover, all of those kids could potentially get infected. And Delta, transmits so much more. So there's so many more virus particles, 1,000 times more. So how do you guys recommend doing lunch? And then who monitors all these things in the schools to make sure they're working?
So first of all, when the distribution of the CO2 monitors went to the administration, the principal and the vice principal, they got instructions to use it, and it's in their hands. It's not in the custodian's hands, no matter if they got a PhD or not. But so, they have their share of responsibilities that are pretty heavy. And we do annual training for all of our custodian and their supervisors. So this is an ongoing program. Hey, Bert, thank you very much. Appreciate it.
Hi, Burke. Thank you.
So we are not reliant on the custodian to monitor. That's not their function. Secondly, but we are reliant upon the administration and really the teachers to make a conscious effort to, if they got an issue, they call their principal, they said, can you have somebody come over here, drop the monitor, let's check it. So that's the cooperation that we need from everybody on that. Like I said, there's training material out there, but that's only part of it, right? We've got to actively engage with the teachers and the folks. Lunches, that also is a decision by the principal and their cafeteria staff and how they manage the flow. The challenge we have is sometimes we've got 4 seatings in the cafeteria because we have that separation, right? So they have to manage it based upon their student population. Some of them have done an excellent job. I've seen, I was out at Waipahu Intermediate, and they've got a huge class population. They got teachers helping facilitate, keeping them 6 feet apart. They've got positions outside in the open area with some covered space so the kids can go out and have lunch there. I was at Hilo High, and they have like a cart outside, right under one of the awnings. So they're doing a good job with the assets that they have. And so that's how it's being managed.
Well, again, I think you were saying a great thing there about engaging with the principals that have been given these devices. I just knew of, I'll just name a school, YK Enter. YK Enter is the feeder school for my high school. I believe it's the vice principal there, was asked about the CO2 monitors from one of the union members, teachers union. And he goes, oh yeah, I have those in a box behind my desk. I don't really know what to do with them. So, maybe the training video that went out got lost in their emails. Like I thought in our conversation we had spoken last week, Randy, you said something about the custodians getting those videos, but now you're saying it's the principal. So that's, that's important to distinguish.
No. The custodians are not getting the videos.
Okay.
They're not managing the device.
Okay. So I think the website that you said for placing fans, that needs to be more accessible to teachers. There's a lot of videos us teachers have to watch in the beginning of the year, the classic bloodborne pathogens. Everyone jokes about it, from the AIDS epidemic. And now, we've got this pandemic now, and yet there's no required videos like that, that you say exist. So, I mean, I think those need to be part of the compendium of videos that teachers have to sign off on in the beginning of the school year, how to place your fans and stuff, because we don't really have the luxury of custodians coming around helping us set up our fans. They're really busy trying to get desks to teachers and trying to solve a lot of other issues, termite droppings, things that have happened over the summer, a lot of, lizard poop and whatever. I mean, there really are a lot of things that happen over the summer that, the custodians, they do their best because they're rotating from classroom to classroom, getting the floors buffed and such. But, as they go it's just like the Golden Gate Bridge. As soon as you finish one end, you got to go back to the beginning, right? To paint it. So I just wanted to say that we do have other questions coming in about the nurses and the staffing for nurses. And I don't know if that is Gary's area or your area, Randy, because we know we've got the Hawaii Keiki nurses, but they're not in every school. We know that for sure. And when we say go to the nurse's office, in a lot of schools there isn't a nurse. It's a health aide. And whether their training is really nursing it's not their fault. That's what they were hired for. And yet we're asking teachers, principals, health aides to do triage, basically, because this is a pandemic and it is a deadly disease. So we did want to ask about that. We wanted to ask about the ventilation in the bathrooms as well. Because we know that, most bathrooms have a little fan in the corner, but that's not cutting it. And we've got kids that have to wash their hands, right? And that's usually the only place to wash their hands, plus the stalls. And those kids are going to go in the stall and take their mask off. That's their one time they can not be seen by anybody to get that mask break, but they're in stalls next to each other. And as we know, they're, with all the in and out in a bathroom in a 30-minute lunch period, you're going to have a lot of spread going on in there. And, even like we know that sewage, right? Sewage has been used to do surveillance testing for COVID in communities. So we know that when the flushing of the toilets, these industrial toilets that flush so vigorously, right? I was telling some doctors about the toilets, how we don't have lids, and they were like, what? That's disgusting. Like, we need to have lids on those toilets even before the pandemic because the feces just fly, So we wanted to ask about the nurses, the bathrooms, and a lot of questions are coming in our networks here about buses, which will be coming up. I just wanted to kind of give you a heads up because we have 3 more topics that are definitely needed to be talked about. So can you address the nurses and the bathrooms for us?
Can I interject real quickly?
Oh, please.
Yeah, so before we move on to those topics, all of this information is distributed to everybody DOE wide in the memo database. And whether anybody ever reads them or not is a separate question, but the information is there.
Just to let you know that since Lotus was retired or sunsetted, now schools are now converting to the Google Drives. And so the things that used to be accessible to all teachers are now really only accessible to a few on campus that are that those memos are shared with. So that needs to be looked into as well, because the conversion of Lotus to Google all the way around, it's making it less accessible. I used to browse through those things all the time. I used to find all kinds of free trainings and stuff. I loved it, but no more. We don't have access as teachers.
Not true, Miriam, not true.
Where are they then? Because we don't know.
All of them, the Lotus system in the DOE is still active. They all have access to it. Yep.
We were told that it's all gone bye-bye.
Who told you that?
Our principal.
Okay, well, I'll call that principal because I know it's active. We dump all our memos to that. So either, like I said, we can present the information to them. They have to consume it, right? That's the way the system is set up for the kind of distribution we have. So I'll check with that principal.
So
Yeah.
just to speak to that, there are web-based Lotus Notes access that I mean, I haven't memorized the URLs, but you can access these databases via the web in a Lotus Notes format, or I believe the memos are also posted on the DOE employee website and the internal website. I believe there is a replication of the memos there. So they're there, but
Do we have the capacity in the DOE to make a dedicated health and safety website that all teachers and principals could go to instead of sifting through all the many memos that come through about all kinds of stuff? Is there any way to separate that out? Because it is just so critical and important at this time.
It is separated out on the DOE website, and there's the health guidance document. There was a return to learn document.
I've read that.
The principals document. So it's all accessible and it's not buried because we understand the gravity of that information for everyone to have. And it was a direction by the board. So it's all there. We've done like 4 versions of it. Every time CDC and the Department of Health kicks something in different, we update that document. And
Oh, the
there's
last version I saw for reopening plan was version 21, I believe it was. I
So
think.
it was redone when we reopened schools. There's also a pandemic plan that we are required to build, and it's also available for staff and DOE employees. So it's all.
That sounds great. We need to start getting that information out there better. So what about the bathrooms?
So I have observed that at a couple of intermediate schools, and you're right. It's just the design of some of these old schools, right? We never built schools for a pandemic, right? We built, and so we have some limitations there, but everyone I've walked into, that exhaust fan is running. Everyone I've walked into, that louvered window is open, right? So what I'm gonna do is I'm gonna take a monitor in there and see what the level of air exchange is. And I'm quite confident that we're getting the turn because the doors open and the outside door open, the stalls have closed doors, and that window is open with the exhaust fan. Now I've seen a few restrooms that don't have the exhaust fan.
Is that
So-
against code?
I don't know, but I will check on that.
Yeah, because I'm thinking of the fire extinguishers and how they come around every year for fire inspections and they have a little tab on there. Can we maybe get a system in place, even if it's not required at the federal level? Our keiki matter and they're precious to us. Can we get some sort of a reporting system like some businesses have, how many times the bathrooms are clean? Maybe we can get that going for ventilation, how many times the CO2 monitor has been used, what time of day? Because I know for a fact, the air wind patterns in Hawaii, they're quite different with the trade winds are blowing, and even the airplanes land in a different direction in Hilo, right? When the air is
Great
blowing
point.
a certain way.
Great point. We are so lucky to have trade winds in our state. And it doesn't always blow, but for the most part, we have been, we're extraordinarily blessed to have these trade winds because that diminished. This morning I was up at 5 o'clock on a national call, and I look at some of these other cities across the country, right? We are super lucky, right?
Well,
Some of
we
these.
count our blessings every day and we pay dearly to live here. But I'm talking about Hawaii's keiki, and that's who we're responsible for and who we care about. So
Muriel, that your concern is our concern.
exactly.
We
we
don't
all
diminish
have the
that
same concern.
one bit.
I think
right?
the timing is the thing that was so upsetting, is that we're opening the schools before we got a chance to make these modifications. Gary, did you have something you wanted to say? It looked like you were raising your hand. No?
No, I'm just
Okay, just
moving. Yeah.
All right, we're gonna move on to buses now. There's been a lot of questions about buses. Kara, have you been seeing what the questions are more specifically? The one that I have are just, what are the protocols for school buses and where do parents report if these protocols are not being followed? So maybe we could start there and then move on to some of the more specific examples we're hearing about. So Randy, what are the protocols for school buses?
So we have district managers throughout each of our complex areas on our transportation routes. So, and we get some of these questions reported to our headquarter office, and we address them relative to amount of kids we transport. On a average, we're transporting from 25 to 30,000 kids a day. Does not include sped kids. So that's the reporting mechanism. They can talk to the principals, and the principals will move it to our transportation division.
We have a bus driver specifically asking if it's safe to seat 2 to 3 kids per seat in buses. Is that recommended or allowed?
So CDC, we went to CDC and Department of Health, and they said that is allowable as long as the windows are cracked open and the kids are masked up. What we work with our transportation providers, we have supplied them with masks. So let's say a kid comes up and they don't have a mask, we give them a mask. If a kid looks a little under the weather, we seat them in that first seat. And when they get to the school, we've let the schools know that we have a child that may be a little under weather. Can you send them, can you take them to the health office? One. So that's how the transportation model is deployed.
If they have more serious symptoms, because we're hearing from bus drivers, I'm looking at the chat thing right now, that the bus drivers say that they literally are getting sick on the bus, like throwing up. And what are they supposed to do? Also, with the cohorting that's happening on campus and the quarantining that's happening, when I know some teachers are being asked to turn in a seating chart to determine close contacts and such. So is that being followed up as well on the buses? Because it seems to many parents that the cohorts are getting all mixed together on school buses.
Okay, so for the first 2 weeks, because we're still taking applications, bus seating charts are incomplete because we keep on taking kids. And if you ever rode one of these student transportations, they sit with their buddies, they move around. For regular ed, there's not an attendant on the bus. For SPED, there's an attendant on the bus. So now that we're moving into the 3rd week and we're still taking applications and making adjustments, soon we'll have the seating charts in place. Now, we fortunately have not had a whole lot of reporting for bus incidences. Now, kid throwing up on a bus is not necessarily COVID related because kids get car sick and stuff like that, but it's all managed through a reporting system. The bus company has to report that out. Our buses also have cameras during this period, so who they sit with, and it has to be vetted. If we can identify the kid, then we'll know the immediate cohort, who they were sitting next to.
And so is that being considered when they're quarantining kids? Because there's been a lot of quarantining going in and out just since the beginning of school. So do we know that it's not just the quarantining of the classrooms, but it's also the buses as well?
Yeah, so we haven't had, what's interesting about the numbers that we're looking at is it's reported not when the kids are on campus, but the parent calls in and says, my kid is under the weather, I'm going to take him for a test. So we can determine, because they become most infectious 2 days prior to the identification. Now, it's not a perfect shot clock, and that's when we start working back. So we have what was called a COVID team. So any reporting goes to the COVID team. We have a health specialist that looks and works with the Department of Health to let them know what we have. And the Department of Health kicks in and determines if contact tracing is necessary. And it has to do with a couple of things, how long they were with their cohort, 15, the distance, all of those things are buttoned together and a decision is made. But most important is the parents go and get the kid tested.
So the cohort, the COVID team, is this at the state level then?
Mm-hmm.
State level.
So how it works is the teacher reports to the principal an incident. The principal reports to the CAS. The CAS reports to the deputy, and our health person, and it goes to Department of Health. And this happens almost instantaneous because it's all via technology, text. And if we have to sanitize the room, that it gets reported to our professional cleaner. We have an app that lets them know what classroom, how many classrooms, and it's the school location. So within 24 hours of notification, if we have to fog that room, it's executed. It's a pretty efficient system.
Okay, one of the things that I heard from a principal is a union member was that the principal mentioned, since the law is to report weekly the cases, that's what they're going to do, is wait till the end of the week and report the cases for that week. And we just want to make sure that the word is going out to the principals that that's not really recommended.
No, so I can tell you that I am on this COVID team. So in a given day, I get, notifications instantaneously. I don't get a pile of them on Friday. I get them every minute of the day. Right. So that's not true.
Gary, can I get a response from you on what are ways we can improve the reporting and contact tracing? Because I know a lot of principals feel burdened that they don't feel supported by DOH in the contact tracing process. Do you have any recommendations of how we can improve things?
That's really not, an area I've been involved with. I apologize. So I'm not going to just say something that I don't really have.
So give us a little overview of the things we've talked about so far. What are your areas then? Because maybe I'm not clear in your role.
So I'm environmental services. I deal with indoor air quality, asbestos, lead, soil contamination, water quality.
Got it. Okay.
And in this environment, and I serve 273 schools. I'm a one-person unit with all those disciplines. And over the past year and a half, COVID-related topics have sucked up 120% of my energy.
Right.
And so ventilation has been, I know from what I've heard from you, I have been, following Richard Corsi's dogma on multi-layered approaches since last April or February, whenever he first, it was late February, I think. So I've been involved in advocating for ventilation improvements, from the beginning. And that was realized in getting some of the federal funds to go purchase air purifiers, to go purchase fans, and carbon dioxide monitors. So that's been the area that I've contributed in. We're now embarking on doing continuous monitoring of classrooms to see behavioral patterns and occupancy patterns and determine whether the systems are functioning as expected. And so
that sounds fabulous. That is what we're hoping for. And when you said about your workload, how many schools you cover, we would like to advocate for more staff for you. But I'm going to pass it on to Frank.
Don't do that. Fine right now.
Oh, you don't want him to have help?
He's doing excellent right now.
We could use some more help, I think. Kara or Frank? Which one you want to go? Frank, go ahead.
I just have a quick question for you, Gary. We know we have classrooms and spaces in school that have very little air changeover to no changeover. Are those classrooms and spaces identified? Do teachers and schools know? Are we still using them? Or is there anything about these classrooms that are being done?
So let me answer that. When we did the metric study, we identified 39 schools and 1,300 classrooms that had limited ability to exchange air in the room. And unfortunately, most of these were the new schools, the new construct, right? So because they were centralized air, and so I can appreciate that, because my time at the convention center, remember that whole anthrax scare? So that building is all central air. And so we had to do some extraordinary things with the filtering and security on the intake areas. So I treated it the same way. Let's look at these classrooms. The list has been distributed to the complex area superintendents, And when they have their principal meetings, they have the list. We've shared that list with the teachers union, HSTA, and we are, like Gary said, we're working on a contractor to help us evaluate and go back into all these rooms. What we have been able to check to date of the 1,300, a reasonable amount, and we're not even close to getting to all of them. But like I said, they're mostly in the new schools that have no access to outside air. So I was out in Holomoa, I think is the name of the school, in Eva, and the principal, we had a good discussion. He's one of those class schools. And I said, are you monitoring? He said, yes. He said his greatest concern was the cafeteria for everything we've said here today. And he's been monitoring pretty aggressively. He's got fans in there, and he's not had a problem. But I said, we got to monitor. So now you got that one identified as fine. We got to start monitoring the other classrooms. I mean, everybody's giving it a Herculean effort. I wish I could tell you we've gone through all the 1,300 rooms and this is where we're going to fix. This one doesn't need help, but it's going to take a little time. And what Gary is doing is just that.
Yeah, and I think Frank's question was, why are we still using the rooms? You know, we don't use condemned buildings, right? So I'm going to pass it back to Kara.
Thank you. I just wanted to chime in with the rest of the bus questions. Sorry to circle back, but we had a bus driver who said that she's asthmatic. She can't go on disability. So she wears a mask with a face shield. She is told she shouldn't wear an N95 mask because it's for essential workers. So first we should clarify if that's correct or not. But then she said her bus is full to the gills, like no physical distancing at all, 3 people to a seat. Another person posted kids are eating on the bus and taking off their mask. So I'm wondering, is there a plan to pay and hire more bus monitors and more drivers to space this out? And are you guys concerned about kids with their mask off on the bus? I mean, obviously the bus driver has to watch the road, so yeah.
Well, we hope they're watching the road. So I don't mean to laugh, but you know, you'd be amazed what you see. As best we can, we try to monitor the kids. We hope that the parents take as much of an interest to coaching their kids to say, listen, you wear your mask, right? We know, we follow the guidance of the CDC, and CDC at some point came back and said, crack the windows, get that ventilation going. And so that's the guidance we follow. The other thing you should know is we have an internal guidance that we will not leave a kid on the curb if we have a seat on that bus. Because if that kid gets lost in that transaction, that is more horrific if we got to go find and do an Amber Alert. So our rule, now I'm not telling you that once the bus is full, what they do is they radio and we sweep another bus in that direction to pick up the kids. But our general guidance is not to leave a kid at the curb. If he looks sick, he sits in that front seat. So yes, the buses are full. The buses are full. The other thing I will tell you in sake of transparency is that there is a national shortage on bus drivers. So we have a shortage here in Hawaii, where some places we've had to consolidate routes, and there's just not enough drivers. The call I was on this morning, Chicago is short 500 drivers. 500 drivers. We're short about 100, right? So it's a major problem for us. And when we started the bus company, so we use private bus companies. There's no way we could afford running our own bus operation, or it's not practical, right? The private companies do the hiring, qualifying. It's not easy to become a bus driver. You got background checks, you've got all of the above and certifications. So it's going to be a little bit of a tough go for a little while until drivers come back. Right? When we called them back, some of them retired, some of them, found other jobs because we've been out so long. But we're doing our best to address that shortage.
Kara,
So,
did you have more follow-up? Yeah.
yeah, well, just to follow up with that, so I know like the special ed buses have a monitor on them. Can the DOE hire and provide monitors for the non-sped buses? Is that in the talk? Is anybody talking about that, or is there any plan to do that?
So we have in our pre-COVID 650 drivers a day. So if you put an attendant on each bus, that's another 650, right? It's all economics.
So the federal funding is available.
No,
And
it's not. No, it's not.
why do you say that?
Federal funding is dedicated to SPED. We are required by law to provide transportation for SPED. A good percentage of the ESSER's money is going towards learning loss in support of the teachers.
Wasn't that a 25%?
And it's more than just that, right? It's devices, it's all of that, right? So it's what is remaining in the budget is not substantial. We've got, like Gary talked about, asbestos and all of that stuff comes out of that tank. And amazing as it may sound, that money doesn't go a whole yard, right? We're building and repairing schools at a pace that is, we like I said, there's not enough money.
And
I
I
mean,
just wanted to follow up on something we spoke of last week. So how was it communicated to the schools about the ceiling fans being advised to be in the reverse direction? And Gary, do you agree with that one? The ceiling fans need to go in the reverse direction for the best optimum ventilation, where there are ceiling fans being used?
Yes, I agree.
Okay, so how is that being communicated, Randy, to the schools?
we sent out a bulletin to them, and they have to execute. They have to execute. And
So
it-
how
it-
can
it's
parents,
like a
how
cheap
can
trick. I
parents,
can see Frank laughing because, I mean, unless I go over there and spin the fan the other way, there's no way I'm going to do that. We got
Well, what I'm
12,000
saying is,
volts, man.
you know, parents and teachers want to know, like, you know, that's their supervisor, right? And they're telling their supervisor, hey, supervisor, you got to turn that fan around. And some teachers are not willing to say that. And parents don't even know where to go to talk about that. And I
So-
have heard parents go into the office and they actually catch the principal with the mask off when they were just about to talk to them about health and safety. And so they feel really discouraged. So that's why I was advocating for a hotline, but you said that you didn't feel comfortable with a hotline.
No,
Is there-
I didn't oppose a hotline.
No, but
What
you said anonymity with the hotline.
No, well, you can't be so afraid to speak the truth, right? And
Well,
so if
people
you,
are.
hang on, Muriel, right? So I share the same frustration, right? But I cannot fix the problem if I've got to go search around the faster I can get the direct problem, the faster I can fix the problem.
Okay, well, here's my question. Could a teacher who's at a school make an anonymous report hiding their own identity, but revealing the school and the problem without having to reveal their own personal identity so that you could follow up? Would that be possible?
Sure. Slip the principal a note.
No, not the principal. The principal's the one not implementing. So can we email you, or can people email you directly, or where would they email or make a phone call to report something that probably is not being implemented fully
They can
because the
email
principal
me.
is not prioritizing it?
They can email me, but understand, right? We've got almost how many thousand teachers? I think like 30,000 teachers, right? So I just cleared my email box this weekend that had 1,200 emails. Right?
Yeah, but
So-
we have 160 some thousand kids that we're trying to protect too. So
Right. So
we
please-
cannot complain about emails when we've got precious children.
Please don't remind me of that. I understand the gravity of the situation. I have 2 children also. They're adults now, right? But I share the same concern that every parent has, because you got to really be a parent to understand or care for kids. We're not diminishing any of that, right? I'm not going to let that get away, but I'm one person, and I need the network of our schools and our teachers and our principals and our staff to get this done. So
Kara, did
that's
you have
what I-
another question? Because you have your hand up. And
Uh,
we're coming up
There's
to
another
hour,
parent
so-
who's kind of asking about the,
Yeah.
not really buses, but all of it in general, I guess. If a bunch of kids get sick on a bus, you're gonna have a huge loss of learning, and that's gonna go throughout the siblings and whatever.
Mhm.
All of them are gonna end up quarantining and having to stay home till everyone's better. She's saying there's a shortage of substitutes. There's kids having to wait in the cafeteria for a whole class because there's no teacher. Is there any plan B? Why are they blindly bulldozing forward with in-person as the only option? So kids are spreading it. Lots of kids are getting sick. It's going back and forth, and that's really harmful to the education. So she's asking, is education really the goal here if you're having so much time out of school from this?
So I will tell you, it's not as much as people believe it is or want to believe it is. We have to report every incident by law now, right? So that means even a kid who is at home, parents reported it. We got to report it. Never been on campus for 2 or 3 days, right? We have to report that. So what we're trying to understand as we evaluate the data is how we bifurcate that data. What is really coming from the schools or reported on schools? How much is reported from home? What the conditions of that access to the school was. Because the data has told us it's not coming from the schools, it's coming onto the schools. The other area we have concern is staff and teachers that get infected that are on school. And we hope that everyone understands that if you're feeling sick, please stay home, don't come on campus, right? And you stop the introduction to the campus. So that's one area we're working on. I'm sorry, the other question, part of the question, Carol?
She's just asking if there's a plan B for, if there is a lot of spread in schools, which I would like to point out, because we had one of the Department of Health directors on here just a couple of weeks ago, that saying they're not really contact tracing anymore. They're just kind of looking at where are clusters when they start seeing a bunch, because they don't have as much time. I know we only have, I think, 6 contact tracers here on the island of Maui. So, if we don't have contact tracing happening, would we ever see that they're spread in the school until you just have so many kids at the school sick that you can't deny it, right? But is
Yes.
there a plan B with spread in schools happening?
Yes, there is a plan B. So we have closed classes, right? Classrooms that cluster because they were in close contact, right? So that is a response to an incident, right? I wouldn't, the plans are based on situational, right? If we get this is what we do. If we get this is the other thing we do. So we have exercised very few situations where we close out a class. The other thing you have to understand, and I'm sure you do, is let's say it's a family of 4, right? And one kid gets sick. So the kid gets quarantined and close contact, all the other kids get quarantined for a 10. So you can imagine the domino effect. And let's say a lot of the kids are not symptomatic until, they get a little fever, sniffles, they're in school, then we backtrack. But we have been, I would have to say, relatively fortunate that is not what's happening once again, because the spread is not coming from the schools, and the parents are paying much closer attention if the child is sick. Now, I won't tell you that we haven't had parents that send the kid to school, right? But fortunately, we can catch them at the gate or someplace in the classroom and say, oh, time out. they look a little under the weather, to the health room. And that's our primary defense, right? In addition to the masking and the separation and all of that, we are not going to solve this problem by just the schools doing this. We need everyone's cooperation.
Randy, when you said something about, the kids had not been on campus for 2 or 3 days, isn't that the exact amount of time that it takes for symptoms to show up? So they could have got it at school and then 2 or 3 days later not been on campus, and then all of a sudden now they're showing symptoms. That seems like the perfect timeline, actually, that they did. do it at school.
Absolutely. But all the data we're seeing now is telling us we've been able to catch it. And we go back 2 days from that point and start that close contact drill. But for the most part, we've been, like I say, fortunate that geometric spread hasn't happened. And it's directly because the tranche of precautions that we are taking and following the direction of the Department of Health, right? We've been, I don't want to say lucky, but we've worked hard at it, right? It's no difference from the 300 people went to the Kaiwi Point on Oahu. They know better. They're adults, yet they still do this stuff, unmasked with potential spread. We're fortunate that our parents take a bigger interest in their child's health and safety. Problem is not the kids. The problem is, working with the adults and the families.
Kara, did you have something?
Sorry, another comment, but I just want to point out, we know of a case where a parent actually sent their positive kid to school because they didn't want them to miss school. So we can't completely trust everybody's going to do the right thing. But this one person asked, is there any testing planned to happen on school so that you could actually see transmission? Is there any plan to get testing on campuses at schools?
There's a lot of discussion of it. Getting those kits and the right kits is in the works. I will tell you, it's in the works. We actually sent 200 kits to Hilo that we can test bus drivers. We're asking the bus drivers that are not vaccinated. We now require that anybody that comes on our campus, drivers, contractors, has to be COVID negative. And they have to take tests every 7 days if they're not vaccinated.
What about the vaccinated people that might be carrying the disease?
Well, it's an imperfect world. We do our best to try to catch them. I mean, it's no difference from a non-symptomatic kid. What do you do, right?
Well, I'm just thinking that, the requirement that's keeping me out of the classroom right now, and I'm burning through my sick leave because I don't feel confident, is that, even if your teacher is vaccinated and there's positive case in their classroom, they're still expected to go to work and not quarantine just because they have a vaccination. But that does not necessarily mean they didn't carry it home. So
You're correct. You're correct.
Right. So we really have an important question. This is from a contact tracer.
I interject something real quick.
Oh, sure, Gary, please.
I didn't memorize it, but there is a memo released in the memo database today about a school-based testing program.
Wonderful.
So, you can refer to that. There were 2 arms to it. And like I say, I didn't memorize it, but it looks like there will be a program moving forward on that. We have to look at what the details are. I'm sorry, I don't know those.
Well, that's good news and sounds like cutting edge breaking news. And, because I know that, for example, my son works for a LAUSD school in Los Angeles, and my granddaughter goes to school there. They have weekly testing available, and they've had it ever since last school year. And it's not just for the students and the employees, it's for anyone who lives with the student or the employee. And it's free testing available weekly. I just wanted to.
But you got to get parental approval. You just can't test any
I
kid.
didn't say that they were just being tested as they walk up. I'm saying their parents bring them there, or they bring their family members there because it's available and it's free. And they know where to go, any school.
And thank you for completing that
Yes.
conversation, because
Yes.
I don't want somebody to believe that they can just kid, you can,
No, it wasn't a mandatory, like walk
Yeah,
up and,
it's
oh,
not.
you gotta get tested. No, it wasn't that at all. But we have a contact tracer that asks a very important question, because these are trained, certified contact tracers. And we know that the principals are being asked to do a lot of contact tracing without the training. So what is a close contact, and why are schools not notifying parents of the exposures in the classroom? Because, the definition of close contact seems to be very fluid.
So first of all, we don't do contact tracing, right? That's Department of Health. We report it to the Department of Health when we get the incident, right? We report it to Department of Health. We don't do contact tracing. We identify potential close contacts and we call. When a situation happens, letters go out to the community advising them that a person has been identified as positive. And so the mechanism kicks in and it goes that way.
Because we have heard of principals having to stay back and make some calls to families and such for follow-up. And that sounded like contact tracing to us. But the thing is, with true contact tracing that's certified, I believe they have to give them instructions where you can go get tested, what you should do at home. And I don't think that's happening with the principals, because of course they're not trained. So
We
that's
don't
what
do contact tracing. We do not do contact tracing.
okay, well, we got to make sure DOH is. All right, so I would like to ask if there are any final comments. Frank, I'm going to go with you first because you've been the quietest. Would you like to make some final comments, and we'll wrap this sucker up, because everyone's been so patient and giving their time, and I really appreciate it. We really, really appreciate it. Frank?
I just want to say that, that's just listening to all the things that Gary brought up, it's definitely positive, and would just like to see more continue to move in that direction, because we know, just how critical it is to exchange that air just to keep the kids safe. And so I do appreciate everybody's time, and I thought it was very productive.
My kitty's coming to visit. Let's go with Kara, beautiful wife.
Yeah. Thank you. I just want to say I appreciate you guys giving us your time in the evening and letting us talk and get a little more information from you. I'm nervous about school this year, I have to be honest. And with all the comments I'm seeing on Facebook, there's a lot of people saying there's sick kids in the school and their kids are having to miss school. I know in my daughter's school, middle school, she went in, she had a doctor's appointment for something else, but I went to pick her up and there was a parent picking up their sick kid. And she said, oh, my toddler here was sick last week. Now my daughter's sick. My older daughter's also at this school. I should just take everyone home. And the principal was there and said, no, if your older daughter's not sick, she needs to stay here. Otherwise, there'll be an unexcused absence. And so I think seeing that firsthand made me terrified. It makes me want to yank my kids out of school because I'm worried that my youngest is not vaccinated is going to end up with COVID. And I know everybody's doing their best. I know teachers are working their butts off, but I'm nervous. I'm really nervous about everything. And I know it's, there's a limit on what we can do, but I do appreciate you being honest with us and letting us know what's happening. I'm encouraged that there's testing coming to schools because that is a big thing. In Maui, we're having a hard time finding testing. So my daughter's been symptomatic once and we had to wait a long time to get testing. And then again, I got symptomatic this weekend and a long time to get testing. And so I kept my kids home actually for 3 days until I could get my test today and find out that I'm negative, because I don't want to send them if I'm possibly sick. And I'll just go to court and deal with those unexcused absences. But I'm not going to spread it in the community. I feel a responsibility to not do that. So, yeah.
Thank you, Kara. And thank you for everything you do in the community with Hale Hawaii as well, because this woman works so hard. She has children of her own, other children that she raises. Her and Frank are such a great team and we appreciate them. They're super parents. Gary, some final thoughts.
I hope that I was able to offer some useful information. I think, Maria, you probably know how to contact me if you have follow-up questions. It's a challenge for everyone. This is an unprecedented situation, and you know, I have a background in doing vaccine and infectious disease research, and so, you know, this is not something that is easy to address, and I think we're all working really hard to do our best. We understand the importance of it, and you know, it's the systems that we work in are not perfect, and you know, the progress is, it moves in spurts, you know, some so you know, Frank, if you want to follow up with me on some of the details of ventilation, I'd be happy to talk to you about it.
Thank
But
you. I love that.
Anyway, yeah,
Yeah.
I hope that we're seeing a peak in this Delta surge. Remains to be seen. If it follows patterns elsewhere, we might be about there, and let's hope we are.
Thank you, Gary. And I just have one quick question for you. When you said Dr. Corsi's dogma, was that in a negative connotation, or do you admire his work?
Not at all. He's one of the people that I've, you know, he's the one that's come up with the layered risk reduction that I communicated early on as being an important strategy. So no, I admire him and have listened to what he has to say, and you know, now he's at UC Davis.
I know he moved from Portland State. I'm trying to get in touch with him to get him on a call for the community here, and we'll see if that happens. Sometimes I make miracles happen. Look at what happened with you guys. You're here. And so, Randy, you're going to have the second to the final word, and I'm going to wrap it up. But please give us your final thoughts.
You know, it's going to take all of us. We need, you know, great parents like Frank and Kara to be responsible, like they're doing with their children, right? It's going to take everybody. This is not singularly sitting on the DOE's lap or the Department of Health lap. It's everybody, right? So I studied animal science in college, so I understand. You know, there was a poultry disease called Newcastle that just ravaged Southern California. The federal government would come in and kill all the poultry. You got no choice, right? So I can understand how this thing spread, and that was an aerosol spread. There's no way you're going to stop it. So they just come in and kill your whole flock, right? People need to understand the gravity of what we're dealing with, right? So I ask everybody, tell your friends, right? Pay attention to what's happening, right? And I understand that some don't want to get vaccinated. That's fine. But it's not a statement that you make for yourself. This is for our community. When you look at what happened to the Hawaiians when Cook first came, right? Some believe there were 1 million Hawaiians. And in a matter of a year, there were like 80,000 left. That's the magnitude of what we're dealing with. So let's all get in this together. Let's work together and get this thing done. Right?
Yeah, when they say unprecedented pandemic, I always think of the history of these beautiful islands. And Gary, I wish I could duplicate you 20 times over, and I'm going to fight maybe a couple.
Yeah, then we don't have to pay him another position or get somebody else to help.
No, we need hundreds of Garys to do these inspections room to room, and to be on top of this, and to be talking, making those conversations happen with principals so they know exactly what to do, and they benefit from people like Gary's expertise. So we are going to push to make that happen. I mean, the timing is incredibly unfortunate that we didn't do this during the summer. Of course, we didn't anticipate the Delta, but you know, now that we know the Delta and its babies, because people are not following protocol. So now Delta is now mutating itself. We've got Lambda coming up, and now Epsilon. We don't know if Epsilon is going to be able to be dominant like Delta, but there are many varieties coming forward. So there's no more thinking it's just going to be over. We've seen the We've seen the statistics. There's a lot of mathematicians at our beautiful UH facilities, UH universities, and they're making the projections. And so it's full steam ahead with the preparations. And we're just not gonna, we just gotta stop, building the plane as we're flying it. We've got to start closing down some of these rooms that are unsafe and putting the kids, offering more distance learning, having less bodies in the room so we can vacate some of those dangerous spaces on campuses. And, more distance learning will do that. And parents are willing to do it that can. So, to make it safer for everyone, I'm pushing for advocating for distance learning. I would like to see a KN95 distributed to every human that walks on the campus for the following day. And we have the resources to do that. In fact, I am in touch with a Vietnamese exporter who's giving me price points for millions of masks from second quarter to the end of the school year, if they do want to remain open. So I'm willing to present that to all the powers that be. And, of course, there's a bidding process in the DOE, but that would be one bid. And I think KN95s distributed to every human for the next following day would be an awesome way to prevent some spread and extinguish this virus once and for all and stop the babies.
I wanted to just point out that Dr. Scott Miskovich has been pushing for that, especially kids-sized,
Yes.
very protective masks, those KN95s, and he's on the Hawaii COVID task force. So,
And with schools opening all over the mainland, KN95s are no longer available on Amazon. So that's why I look to my sources for the bulk purchases that DOE is capable of doing. So that's what I'm pushing for. And I think we can get it done. And if it takes donations to supplement whatever the feds are going to give us, we have the resources in our state because people should love keiki.
Muriel, just one.
It's Mireille.
Yeah, just one comment about PPEs.
Yes.
So all our schools are plussed up with 20 days of inventory. They are choking with PPEs and
Surgical masks.
No. KN95s, which we got from Haima. And we have.
We would love to see the numbers on those distributions. If you could send that to us, we would love that. You could send it to our union.
We have an automated system that every school's business office reports on a weekly basis on what the burn rate is. And I will tell you, the burn rate hasn't been there. What is happening is parents are giving their kid masks and hand sanitizers. So the burn rate isn't happening, right? We had geared up running a formula on what we thought the burn rate was going to be. I mean,
can you explain the burn rate? I don't know what that is.
Use rate, how many they go through, because a lot of them are disposable. Yeah, so it hasn't happened, and
well, kids weren't on campus very much last year, so I know a lot of distribution happened with surgical masks last year. And actually, one of the art teachers at my school showed me an expiration date on the mask box that she'd been given. But when I asked nurses about it, they said it's probably the elastic gets brittle and breaks, which they say is very common. But the thing is, child size masks, because fit is everything. Fit. So we need the child size KN95s, which are very rare.
We have child size masks. We have clear masks for those kids that are at the deaf and blind school in Kaimuki. So it's there. We got gowns, gloves, booties. I mean, they're having problems storing this stuff. And I've got a 2-day immediate supply to refill that anybody's got short. We've taken care of Molokai, Lanai, and Hana because they're hard to get places, and we've doubled up their inventory. So we've taken this extraordinarily serious because, like Gary said, the battle is won by the multiplicity of defenses that we can put up. Right. So
if teachers request these masks or PPE and the principals say that they don't have them or they're saving them, what should be done?
Then they can call me, they can email me, and I'll get them out.
Randall with 2 L's Tanaka at K12HIUS.
I will say our youngest was sent home twice last year in an adult size surgical mask that was too big. And I was disappointed when I picked him up, and because he had made his other masks dirty, and he forgot he had extra mask in his bag, but they weren't KN95s. They were just surgical masks and they were adult size. So I do think there needs to be a better communication maybe with the school administrators that kids need to wear the KN95s at school.
We had a ton of N95s, but the N95, it's a good mask, but there's a fit requirement. So, so the Department of Transportation provided us a tremendous amount of them, but, becomes voluntary. But other than that, thank you everyone for your time.
Thank you. Thank you for your time. We really appreciate it. And, us grassroots activists don't get the big bucks, but we get paid in information. So we appreciate the payment that we received in kind. We hope to continue this conversation and we hope to hear your progress. Maybe we can have another one next month, see what's going on. And the issues, we've already spelled them all out and hopefully there won't be any more.
It's dynamic. It's always, there's no absolutes in this game. I mean, the rules may change tomorrow morning with the variant. And so we just got to roll with it. I mean, everybody hang in there because it's going to be a rough ride.
All right. Well, thank you. And I apologize to those of you watching. I've had some camera issues. I'm having some psychedelic faces going on. I don't know if that's showing out in Facebook land, but I hope you enjoyed the psychedelic face show. And we will reconvene another time. And please feel free to come on highcovid.org calls. They're open calls for Wednesday at 6:30 at this time slot. We have further discussions with parents and teachers and community members of all kinds. And we invite, medical professionals are often on the calls to help inform us. And we invite Gary and Randy and anybody else who's listening out there to come join us and participate in further discussion. But thank you for tonight. And I think 96 minutes is pretty much our limit for today.
Bye, guys.
Aloha.
Aloha.